Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I'm Will Rucker.
And I'm Ciara Owens.
And we are so glad that you've joined us for today's program. We're not going to spend a lot of time before we get into the content because we got some spicy content today.
We do. I really enjoyed the conversation before the show, so I can't wait to sit there and see what we do while we're on air.
Oh, yeah, it's going to be good. Right? So text your friends, put it on your Facebook. Do people still use Facebook?
I don't know. I'm off of social media. You already know. I've been off since October.
Well, we'll send out your carrier pigeon and let folks know A Healthier Tomorrow is on the air. Joining us live in studio is Ciara Connors, a graduate student at UNLV and close friend, right? Dr. Brian Labus, associate professor at UNLV. And also he'll share a little bit about a role that he's recently added with the Nevada Immunization Coalition. The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. The Southern Nevada Health District is dedicated to ensuring that infants, children, and adults are immunized against vaccine-preventable diseases. To book an immunization appointment or learn more, visit our website at www.southernnevadahealthdistrict.org or call 702-759-0850.
All right, our amazing guests. Would you like to take some time to introduce yourselves?
Hi, everyone. My name is Ciara, and I am a graduate student at UNLV, and I work with Dr. Brian Labus in the field of public health.
Amazing.
And I'm Brian Labus. I'm an associate professor at UNLV. I'm an infectious disease epidemiologist. Been doing this in Southern Nevada for 25 years. If you've gotten sick in the last quarter century in Southern Nevada, I was probably involved in investigating it in some way. So I've dealt with many of your listeners before, even though they didn't know it, going all the way back to 2001, all kinds of outbreaks, foodborne stuff, Legionnaires, stuff on the Strip. It's been a fun career.
Oh, my goodness.
What brought you into the career?
When I was an undergrad, I took a class in epidemiology and thought, this is what I want to do. And I saw the movie Outbreak and thought, oh, that's kind of cool. Didn't wind up going to Africa to track down Ebola like they were doing, but it basically showed me that I can work in medicine without having people throw up on my shoes. So I got to do the infectious disease stuff that I really love, and I do it at the population level. So I can protect millions of people with something that I do, which is just an amazing feeling that at the end of the day, you can make a difference for the entire community or the state or possibly the country if you do things well.
Listeners, I wish I could see his face, the way his eyes light up and the smile that he has. You can tell that he loves what he does, and that means that he really is putting that care and the energy behind it.
Yeah, and Ciara, what about you? How did you get into epidemiology and biostats?
Really similar to Dr. Labus, I love the idea of helping the community and medicine, but without that direct patient experience because I don't do well with bodily fluids or anything like that. So I definitely wanted the chance to contribute to helping our community, and I felt like public health, specifically epidemiology, was a way that I could do that.
I love it. I feel like I'm with my people. I'm married to a nurse, and so he loves all that. Like, he used to practice on my arm, like, to find a vein, and just gets really excited. I'm like, no, I don't want sick people. I don't want blood. Like, that's not my thing. Like, let's keep people healthy. So I love that you folks are here. Thank you for joining us for this morning's program. So you co-founded the is it NVVAX? Is that how you say it? NVAX. Okay, there we go. Tell us a little bit about that organization.
So NVAX is our Nevada's Immunization Coalition. We just founded it this past year, and really it's to help improve vaccination rates across the state. But we know that no single provider, no single professional or agency can do that work by itself. So we really want the coalition to serve as a place to bring people together to help share resources, identify those barriers, and ultimately just improve the health and wellness of Nevadans.
I absolutely love collective impact and how it really is right now, really like emerging across all sectors. Who are some partners a part of the coalition?
We've got about 250 different people that have signed up so far. So we have people from all over the state. We've got school districts. We've got different medical organizations, individual providers. We've got different departments within the state health department. We've got local health departments. A little bit of everybody from throughout the state. So it's a lot of different people who just have this general interest in immunizations and want to be part of the solution.
So you said a word, immunizations. I want to go very, very basic and just say, what the heck is that?
So an immunization or a vaccine, we kind of use those terms interchangeably. Let's not get caught up in the technicalities of the exact differences. Basically what it means is we're injecting something into your body that your immune system can then respond to. So the next time you're exposed to it in the real world, you've seen it and your immune system can respond faster. So it's not the first time you've seen the disease, it's you responding to something your immune system already knows how to fight. So that's the whole idea. We're trying to get your immune system ready for battle, basically. Anybody that says, I don't need a vaccine, I have an immune system. Well, a vaccine actually primes your immune system. We need both those things. You can't have a vaccine that works without an immune system. It gives your body the knowledge it needs to fight things off and keep you from getting sick in the first place many times.
So does that mean if I get vaccinated or immunized, I will never, ever, ever get the thing that I got the shot for?
Unfortunately not. There are times when you can get vaccinated where it doesn't work. So say you have a depleted immune system, say you're undergoing chemotherapy or something like that, or have some sort of immune problems, your system won't be able to respond as well as somebody who's younger who has a stronger immune system. So what we're trying to do is get your immune system ready for battle, but if your immune system's not great in the first place, it may struggle. But when we do vaccinate people, even if it keeps you from getting sick, it can, or even if you still wind up getting sick, it can keep you out of the hospital or it can keep you from dying. So it may not keep that illness away in the first place, but it may give you a much better outcome. And I think keeping people from dying is a really important thing to do, in addition to preventing the disease in the first place.
Yeah, I think it's really important to talk about it in that way, because I think there's a perception that if you are immunized or get a vaccine, it means you will not get the thing. And so I think those are important facts just for people to understand.
It's kind of like any medication. Things don't work for everybody all the time. Even if it works 99% of the time, there's going to be 1% of the population that still doesn't have a response to it. So it works really well for just about everybody. And that's what we're going for when we test our vaccines and we bring them to market. We want something that is going to provide a very high level of protection, but to expect 100% is completely unrealistic because it relies on the human body, and everybody's body is different.
So as we're talking in the simplest form, and before we talk about specific vaccines, are they safe?
Absolutely, yes, but that's an oversimplification. So what you have to look at with vaccines is the safety of the vaccine compared to the safety of getting the disease. And those are the comparative decisions that we have to make. So if we have a vaccine that causes death in 1 out of 1 million people, or 1 out of 10 million people who get it, something really rare like that, but the disease itself kills 1% of the people who get it, the vaccine is going to be much, much safer than getting the disease itself. So it's
1% is 1 out of 100.
1 out of 100. So something like measles, that's about the death rate that we saw before the vaccine era, where 1% of people that got measles died. We still see that in lower income parts of the world, where measles is a top 10 cause of death. The measles vaccine, it's not perfect. Yes, you can have a bad reaction to it, but it's 1 in 1 million, 1 in 10 million or more. Those things are very, very rare outcomes that we would see. So the risk of disease is so much higher than the risk of anything that's going to happen with the vaccine. That's that comparison we make. It's kind of, we're playing the odds. We're here in Vegas.
Yeah.
And so that's what vaccines allow us to do. We play the odds, pick the thing that's going to give us the best protection with the least harm compared to a disease that is going to cause a lot of damage. And that's how we decide which diseases we're going to go after. We don't have vaccines for really mild stuff. We focus on the things that are deadly. We focus on the things that put people in the hospital. So that's what we're looking at, is how do we prevent those things from happening? Even though there's a tiny risk from anything that you take, like any medication, the risk of that is so low compared to the risk of the disease itself.
I want to just kind of double click in on the safety component, because there's a fear, particularly in communities of color, that a lot of vaccines are experimental.
Yes.
Can you talk a little bit about how they're researched, how we know that they're actually safe?
Every vaccine starts as an experiment. You come up with something in a laboratory and say, I want to try this in people. And we have a bunch of different steps we take. We do things in cell cultures or animals and work our way up to humans. And then we have a whole clinical trials process where we first find out if people are going to get a response, how much can we give them safely. If I give you the vaccine, it's going to make you really sick, we'll probably never be able to go beyond that. And then we want to show that it's both safe and effective, so that when I give you the vaccine, I'm not seeing all kinds of side effects, and it actually is protecting you against the disease it's supposed to protect you against. So it goes through all of those things. The last step are these big clinical trials people hear about. With the COVID vaccine, our clinical trial had 40 or 50,000 people in it. And so we do these giant comparisons, and then once we get through that, it gets approved, and it comes to the market then as an approved drug. So the COVID vaccine, when it first came out, was still called an investigational new drug. It was brand new, and we were still working through all those trials. That's over. Everything that we give as a vaccine has been approved by the FDA. It's gone through all the clinical trials. We've shown that it's safe. We've shown that it's effective. We decided as part of our public policy it makes sense to actually vaccinate people with this, and that's why it's on our list of recommended things.
All right, so it's back to school season. CCSD started on Monday. Other schools started just today. Talk to us about some school-related required vaccines.
So there are a list of vaccines, and it depends on what age you are. So coming into school, there's the first set of vaccines that happen for the youngest kids. There's a lot more there. And then the adolescent ages, when you get into junior high, there's a second set of vaccines. These are all set in state law in Nevada. So it's not something that CCSD decides. It's not something that individual school decides. But it's basically all the stuff that you should have had according to the recommendations when you were 1 or 2 years of age. So by the time you get to school age, you'll probably need a booster. But there'll be things like the MMR vaccine, the measles, mumps, rubella vaccine. You need a series of pertussis vaccines. You need polio vaccines. So there's a bunch of things that you get. And then when you get a little older, there's some other ones that we add to the list, things like meningitis. In Nevada, we also require hepatitis A. Not all states do that. We started doing that about 25 years ago because we had some of the highest Hep A rates in the country. So the states with the 10 highest rates, they encouraged us to put that as part of our schedule. So Hep A was something that we dealt with here in Southern Nevada, and so that's part of our requirements for school as well.
I will say, out of all of the vaccines you just mentioned, only the Hep A even remotely sounds familiar as far as something people acquire. And to me, that's just an indication of how effective vaccines have been, because we don't have these strange sounding diseases plaguing our communities.
Well, I think that's also been one of the challenges with vaccination. We have not seen these things in a generation or two. Nobody under 50 years of age has seen measles. They didn't go to a school that had an outbreak of measles or mumps or anything like that. And so people get afraid of the vaccines because they're not afraid of the diseases. They haven't seen polio. They don't know what happens when you get it. Something that grandparents, great-grandparents dealt with as part of life. We don't worry about it anymore. So now we can worry about the vaccines. Well, the problem is when we stop vaccinating people, those diseases can make a comeback. And so it's kind of the challenge to tell people these things are still important, and just because the disease isn't around anymore doesn't mean we stop vaccinating, because that's how we keep the disease from coming around again.
So as we think, what are some diseases right now that we're seeing a rise in the United States that thankfully is not really here in Nevada just yet?
We've been seeing a lot of measles cases rise across the country, and thankfully we haven't seen that in Nevada yet. But I do think it's important to note that measles is highly contagious, and it can be really dangerous for young kids, but at the same time, it's extremely preventable with the MMR vaccine. So I think as we're seeing like our neighboring states, such as Arizona and Utah, have rise in cases, it's really just important to recognize that we can take that time to make sure that we're up to date on our MMR vaccines.
Sarah, why haven't we seen it here in Nevada yet, especially with Utah and Arizona being so close and being such a transit city?
I want to say it's a little bit of luck. Yeah, I think it really just is a little bit of luck, and the fact that we do have the school-based immunization requirements, and that definitely can contribute. But yeah,
it's been a big question. Why are we not seeing it here? You know, in northern Arizona, southern Utah, they've had big outbreaks of it. We're also talking about isolated rural communities that have seen it, and the vaccination rates in those areas tend to be pretty low, just like the outbreak we saw in West Texas last year. It were these kind of isolated communities that stay within their group, and nobody's vaccinated. So you introduce measles, and it just explodes. We don't have those same isolated communities here in southern Nevada or throughout Nevada at all, really. And in the communities we do have, our vaccination rates aren't the greatest, but they're also much higher than we're seeing in those neighboring states. So they have just some differences in the groups of people. And diseases aren't something that happens to individuals. They're something that happens to communities. And that's why these vaccines are so important. We're protecting the community in addition to the individual people, because it has to spread from person to person. Say you're talking about like a sexually transmitted infection. We have to get it from somebody. It's not just you. There's a network. And the exact same thing is true for measles or flu or anything else. Disease spreads among the population, among the contacts that you have, and by protecting the community as a whole, we can keep these outbreaks from happening.
I think that's something just to highlight and really reiterate, because when we're even thinking about the school vaccines, some parents feel like, well, I don't think my kid is in danger, but it's bigger than just the one person. It really truly is about a community, and so I appreciate you sharing that. I am curious though, because we've heard a lot of this in the news. Does MMR cause autism?
Absolutely not. There has been no valid scientific study that shows a link between the MMR vaccine, specifically the measles component, and autism. I know that's something that's kind of an internet rumor that's out there. Basically, it came from a tiny little study that was fraudulent, happened in the 90s. The study was retracted, so there's been no scientific evidence. We keep looking for that. If that vaccine actually did cause autism, we would be concerned about that. That's something we'd want to know. So when these claims came up, we started studying it. We looked all over the world. We're not able to find that strong link. And I think the best example of this is after that study came out in the 90s, in the UK, the MMR vaccine rates dropped off. Everybody got afraid of the vaccine, so they stopped vaccinating their kids. Autism rates continued to climb. If we stopped vaccinating and we saw the autism rates drop, we would say, oh yeah, there is a connection. Those two things are unrelated. They wound up having a bunch of measles outbreaks, and it did absolutely nothing to stop autism. So those two things are not related at all. It's unfortunate that that's the rumor that is still out there, but we've looked at that over and over again. It's not like something we want to hide. If that were the case, we'd absolutely want to know that. We keep looking for it and can't find that evidence.
It's crazy because it seems like false information travels so quickly, but the correct one takes a little bit of time. How do we know who to trust, and where do we get our information from?
Well, we can definitely trust the organizations that have children's health as their best interest in mind. So that includes the American Academy of Pediatrics. It also includes local health departments and providers. And I think it's really important that parents and families are open to having those conversations with providers and with their health departments, because nobody just wants to blindly vaccinate your child. And that's not something that anybody should really do. You should never blindly inject anything into yourself or into your children. But being able to have those conversations, ask those questions, and have trusted and reliable information, again, from local health departments or the American Academy of Pediatrics, is really where those conversations start and can help parents make the best decisions for their families and for their kids.
Off air, you all set a term to talk about these conversations that we should have with our doctors in relation to vaccines. What was that term?
Well, we've seen this come out a lot lately, where we're talking about patients and doctors deciding what is best for them. And so no matter how it's phrased, that's the kind of idea that we're talking about. It's having a conversation with your provider and making the best decisions for you and your health. And that should be part of medical practice no matter what. So anytime we have these decisions that are being made, it's really a provider and a patient talking about it, or a provider and a parent talking about it for their kids. And that education, that discussion should lead to decisions about your health care.
The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Did you know a full tummy may help your child perform better at school? Help them make the grade with nutritious meals at no cost. To view the menu for students at CCSD, visit menu.ccsd.net. All right, so that's our transition to another question now.
All right, so what advice would you give a parent that does not necessarily want their students to be vaccinated?
I think look beyond the stuff you see on social media about all kinds of crazy things. Anybody can say anything. Look to trusted authorities like Ciara mentioned. When we've looked at the national studies, they show that people trust their pediatrician, they trust their doctor, and they trust national groups like the American Academy of Pediatrics, the American Medical Association, and they trust their local health departments. Those are the groups that tend to have the trust of the community. And those are the places where you're going to get the best information. There are a lot of different recommendations out there about what to do. And if you look at basically all of those national groups, they make the same recommendations about vaccines. So all of America's healthcare providers are on the same page as to what vaccines you should get, when you should get them, why you should get them. A lot of times parents are worried about too many vaccines at one time. Well, I want to get my kids vaccinated, but I don't want that many shots on one day. And I can completely understand that. You don't want your kid to suffer. It's not a concern for the immune system. The immune system could handle every vaccination we get in our lifetime given all on the same day. That's not a problem. You have plenty of immune capacity. The way we came up with that schedule is looking at when do kids actually go in for their visits. So you have a checkup at 1 month, 2 months, 4 months, 6 months, all that kind of stuff. And we also look at when the diseases occur. So if we know the parents are going to have the kids in the office and we know the biggest risk is under a certain age, we're trying to get the vaccines ahead of that. Like if you get your pertussis vaccine right before school, well, that's great that you did it, but the biggest risk is kids under 6 months of age. So you've missed the opportunity to actually protect your kids. That's why we have the timing on the schedules that we do.
So talk directly to a parent that doesn't want their child vaccinated. What would you say?
Well, there isn't one message I could give to every parent because every parent has a different reason as to why they don't want to get their kid vaccinated. I think we could probably all agree that we're starting at the same place. We don't want to see their kids sick. No parent wants to see them sick. I don't want to see that kid get sick. The question is, what makes them hesitant to get a vaccine? Is it a concern about the safety of it? Is it some rumor they heard? Why are they actually concerned? And then that's the thing I would talk to them about, because there can be a lot of different reasons. Everybody's unique. Everybody has their own view on things. And so there isn't a one-size-fits-all message. I think if there were, it would make my job really easy. We could put that out on an ad campaign and say, here's the information you need, and parents would go, okay, that's great, and get their kids vaccinated. But it doesn't work like that. It really comes down to the parents making those decisions, that shared clinical decision making with their doctor, having those conversations that address their specific concerns or fears. And that's kind of how you have to do it on a one-on-one basis. It's not something that's easily done on a radio program like this where I can get it out to the entire community. Unfortunately, it takes a lot more work than that, and it's those one-on-one talks with parents.
And so how does Nevada actually stack up? You've kind of alluded to this in some comments, but how do we really stack up when it comes to our vaccination rates?
Pretty much like everything else in health, we are at the top of all the bad lists and the bottom of all the good lists, unfortunately. So, well, as frustrating as that is, it is kind of exciting to work in public health because we can do so much good. Yeah. We have a lot of opportunities to improve things. So if you look at our vaccination rates, they tend to be pretty low overall. Our immunization exemption rates in schools are high compared to the rest of the country. They're also climbing. We were about 6% in the public schools, but 2 to 3 times that in some of the private schools. So there are a lot of kids in the private schools who are not getting vaccinated. And if there's an outbreak of one of those diseases, those kids are going to have to stay home till it's over. We had an outbreak about 10 years ago when I was in the health district of measles. And I remember talking to parents about that, and they said, why don't I get my kid vaccinated? And I said, well, okay, that's fine. You have that right. But your kid has to stay out of school until we declare the outbreak over. And the outbreak's not over until 2 incubation periods past the last case. And for measles, that's 2 times 21. So your kid is out of school for 42 days, wow, assuming there are no other cases. So even if you don't get vaccinated, there are consequences to that. People think, oh, I just signed the form and I don't have to get vaccinated. Mm-hmm. No, if something happens, then your kids are going to be out of school. So our exemption rates, back to your question, our exemption rates are unfortunately way higher than the rest of the country. And these are the kind of things that we are struggling with here in Nevada.
We've got about 3 minutes left in our conversation, and I just want to address the big elephant in the room, which is the national news around executive orders and vaccines. Could you address how that impacts us as Nevadans?
The simple answer is it kind of doesn't yet. First of all, everybody thinks, well, the CDC says something or the White House says something, and that's now the rule throughout the country when it comes to immunizations. Those groups make recommendations. The CDC has a recommended schedule. The American Academy of Pediatrics has a recommended schedule. It's up to individuals to follow recommendations or not. So no matter what happens, these are recommendations that you're encouraged to follow, but there's no law that says you have to. The other thing to keep in mind is that public health, as a matter of constitutional law, is a state and local issue. So the feds can't say, here's the stuff that you have to do. It's up to the states to make those decisions. We have laws in Nevada that say what vaccines you need to get to go into school. And no executive order from the president can change those things for good or bad. It doesn't matter what they say. If they want to add 10 things or get rid of all of them, none of that changes Nevada law. It's up to us to decide what makes sense for our community and how best to protect all the kids in our schools. So even though this order is out there, it is just a recommendation. It's also the same thing that we tried, or that was tried about a year ago, where they totally changed the committee that looks at immunization recommendations, and all of that was shot down by the court. So this is basically trying to go around the court's decision and implement this in another way. I'm sure there'll be a giant court battle and a lot of stuff to happen before it matters at all. But even then, Nevada law is Nevada law, and nothing that comes from the federal government is going to change that.
That's really good to know, because I was wondering as well, how does it trickle down? So thank you so much, Dr. Brian and Ciara, so much for sharing this information. It's definitely important. All right, we got some time for some events?
Yes, we do.
All right, y'all. So kickoff to kindergarten is this next Saturday, August 22nd, from 10:30 a.m. to 1 p.m. at the East Las Vegas Library. It is an opportunity for you to prepare your child for school at the University of Nevada Reno Extension School Readiness Fair. Attendees will enjoy fun hands-on activities, also learn about the Nevada pre-K standards. You'll see the CCSD book bus, UNLV dental screenings, and a produce market will also be available. This event is designed for children 3 through 5 and their families. Black Breastfeeding Week event will kick off on August 29th, 2026 from 11 a.m. to 2 p.m. We all we got. We're going to be celebrating 15 years of community care and collective power with the 11th annual Milk Depot. So on Saturday, August 29th, you will be able to join us at Nevada Partners to help parents and babies by donating milk, essential items, and resources. Together we nourish and uplift our community. Y'all, the pop-up produce stands will be at the Bonneville Transit Center September 1st and 8th, as well as October 6th and 13th, and November 3rd and 10th, from noon to 3 p.m. or until sold out. Come out, shop for a variety of affordable fruits and vegetables at the Fall Park Up Produce Stand. You can use SNAP EBT card as well as cash to bring home healthy, nutritious food. And we have Walk for Healthy Living, which is the 31st annual walkathon. It'll happen Saturday, September 26, 2026, and it is located at the field at West Prep Academy. Registration begins at 8:30, warm up at 9, and walk up begins at 9:15. And y'all remember our last show from last month, the Kiki Ball is this weekend. Join the center and our friends as we celebrate our youth as we lean into some amazing events.
Fantastic. Thank you for keeping us informed on what's happening in our community. Ciara, before we go, folks have questions. I know they want more information. How do they get more information?
So in Nevada, a good place to get your information is any of the local health departments. If you're curious about vaccine recommendations or requirements, the health departments are a great resource. NVAX, our immunization coalition, is also a great resource. You can find us online at any of our socials or the website, nvax.org, and we have a lot of great educational resources there.
Awesome. nvax.org. This has been A Healthier Tomorrow.
I'm Ciara Owens.
And I'm Will Rucker. And as we always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So live compassionately. Tune in next time.
Have a great day, y'all.